Darent Valley, 1 in 3 of our women have their pregnancy induced. The reasons for your induction range from your pregnancy being overdue, concerns with your baby, or concerns with your own health. Your midwife or your doctor will explain the reasons we are recommending for you to be induced. Being induced will always be your choice. We will work in partnership with you to make the safest choice for yourself and your baby. Once the induction process has been explained, the midwife or doctor will complete the booking form page in your antenatal notes. You will then be asked to sign the area shown to say that you accept and understand.
Now the decision for your induction has been made. We would like to show you where your induction will take place and the process involved. You will be given a date to call CEDA ward. Normally we ask our women to call at 9 o'clock and invite you to attend. This can be done at any time of the day.
This is CEDA ward. We're located on level 3, junction 12. This is our antenatal ward, where the majority of our inductions take place. Sometimes your doctor may ask you to be induced on delivery suite, but that will be discussed with you prior to your arrival. Our ward manager is Marie Penny. We have a dedicated team of core midwives who work on CEDA who are very confident with the induction process. Please feel free to speak to any of us if you have any concerns or queries during your stay on CEDA.
When you arrive on CEDA ward, the midwives will ask you for your antenatal notes. We then perform our routine admission tasks. At present, this includes weighing you, a COVID swab, and showing you all the ward facilities. The midwife caring for you will then take time to read your notes to understand your pregnancy journey in detail. The midwife will then perform observations to ensure you and your baby are well before the induction is commenced. Your baby's heartbeat will need to be monitored on a CTG machine. At this stage, your midwife will then discuss your options to start your induction. At Darent Valley, we recommend the method used is based on 3 very important things. Firstly, your preference, the reason you are being induced, and the findings when the midwife performs the initial examination to assess your cervix. The majority of our inductions are commenced using Dilapan or Propes. The aim of both methods is to open your cervix so we can reach the sac around your baby to break your waters. We will now show you both options in more detail. Dilapan is a mechanical method of induction and doesn't use any medicines. It is mainly used if your cervix is already slightly open and your baby's head is low. Or we recommend Dilapan if you previously had a caesarean section. 4 of these small rods are placed into your cervix to stretch and soften the opening. The rods are left in place for between 12 and 15 hours. During this time they expand to look like this. You will hopefully not feel any discomfort during this process. The removal of the rods is not uncomfortable for most women. Our other option is Propes. Propes is a hormonal method of induction. It is a small pessary that contains 10 milligrams of prostaglandin medicine. This is placed behind your cervix and the medicine slowly releases over 24 hours. This method is often used when your cervix is completely closed at the start of your induction and your baby's head is still high. With the use of Propes, you may find that your contractions start after the insertion due to the hormone medication. This is less likely when using Dilapan. The Propes is removed after 24 hours. You will not have any vaginal examinations during this time unless your labour starts. In some circumstances, especially if this is not your first baby, the midwife may find when examining you that the cervix is already open enough for your waters to be broken. You will therefore not need Dilapan or Propes. Your midwife will explain these findings at the time of her examination. At this point, the midwife will ask your consent to perform a vaginal examination to assess your cervix. Your legs will be placed in a lithotomy position to help tilt your pelvis and so the midwife can reach your cervix easily. Your birth partner can be with you during the examination. Your midwife will offer for you to use gas and air to make you feel more comfortable. After the examination, you'll be placed on the CTG machine again to ensure your baby is okay. This will be on for an hour if you've had Propes, or for half an hour if you've had Dilapan, or if we can break your waters. If you had Propes or there are concerns with your baby, the midwives will monitor your baby every 6 hours. In some cases, monitors are only required every 12 hours. The midwife looking after you will let you know when your next monitoring is due. In between your monitorings, we encourage you to be as mobile as possible. You're welcome off the ward for walks, but please speak to your midwife before you leave the ward. On Cedar Ward, we have birthing balls and a bath to help you remain comfortable. It is important to be aware that pain relief is always available on Cedar Ward. During your induction period, we can provide you with oral tablets and pethidine if required. Pethidine is an injection that goes into your leg or bottom to help ease the pain of your contractions. Your midwife will help you understand what's best for you according to the stage of your labour. Please always tell us if you start to feel uncomfortable. Gas and air and an epidural are both available when your labour is established. However, an epidural can only be given on the delivery suite. You are welcome to bring your own food and drink to the ward. Breakfast and a selection of hot meals or sandwiches will be provided to you during your stay, but please always bring food for your birth partner. There is a fridge and a microwave for their use. Currently, you are allowed one birth partner on Cedar Ward. If you have other children, they can visit between the hours of 9 and 9 if you feel this is appropriate. Please be aware that at present there is no swapping of birth partners on Cedar Ward. In some circumstances, after Propes or Dilapan, your body may go into spontaneous labour. If this doesn't happen, your Dilapan or Propes will be removed by your midwife. A second assessment of your cervix will then be performed. If your cervix is not open for us to break your waters, your midwife will discuss the use of Prostin gel. Prostin gel is a hormonal prostaglandin medicine. It is in a smaller dose than Propes and it comes in 1 or 2 milligrams. It is absorbed quicker as it comes in gel form. If Prostin is required, your baby will need to be monitored before and after it is given. You may also require more than 1 dose. This is assessed every 6 hours. Each woman's induction of labour on Cedar Ward can vary in many different ways. For example, if you have prostaglandins as your first method, we occasionally offer to then try Dilapan if we are unable to break your waters. Also, if you have Dilapan as your first method, we can often suggest using Prostin gel after. This can help soften the cervix and may start some contractions. Please remember this will not always be the case if you've previously had a caesarean section. All of these options will be discussed with you and will be centred around your care. When you're in active labour or your cervix is open enough to break your waters, you'll be transferred to delivery suite for one-to-one care. The delivery suite midwife will monitor your baby and perform a vaginal assessment ready to break your waters. This is done with an amni hook. We know this can seem scary, but it is often not uncomfortable for most women and it won't harm your baby. If your baby's heart rate monitor is normal, you will then be given time to mobilise to see if your contractions start. After 2 hours, a consideration will be discussed with you to start the hormone drip. This can be delayed or may not be needed if your contractions have started. Please be aware that once you are told on Cedar Ward that we can now break your waters, this needs to be done on delivery suite. There will often be a wait for a room and a midwife to be available to provide you with one-to-one care. We will of course ensure that we keep you and your baby safe while you're on the ward. You will be updated regularly, but please ask if you feel unsure. Bear in mind that the wait can be over 24 hours during busy times. We would like to mention that sometimes induction is not always successful. Your midwife and the doctors will work in partnership with you to decide which next option is best for you and your baby. Our aim on Cedar Ward is always to give you a positive experience, so we wanted to give you some extra advice. Please be aware that not all inductions do happen quickly. Your stay with us can sometimes be between 2 to 4 days, so please arrive with this in mind. Feel free to bring any of your own entertainment, books, laptops, iPads. The hospital has a free Wi-Fi network that you can use. Your birth partner is welcome to stay overnight with you. We can't provide any sleep comfort, so please bring a pillow or a blanket if you feel necessary. You may have chosen or been asked to express breast milk prior to your admission. We have a fridge and freezer storage on the ward, so please give to the midwife on your arrival. Lastly, although you are given a date when your induction is booked and you will call on this date, please be mindful that in rare cases this may need to be delayed if you and your baby are well due to ward activity. Ultimately, your comfort and your choices are our priority. We will always work together with you throughout your stay to ensure you have the best experience possible.